Hi everyone, I'm Dr. Arti Sharma, obstetrician and gynecologist associated with Aesthetica Veda. So you can find me either in Whitefield branch, HRBR layout or Kormangala. Hymenoplasty. As I always tell my patients, it's not an emergency surgery, it's not a life-saving surgery. But yes, the society that we live in, sometimes it really becomes a life-saving surgery for some females. Now, this procedure is very simple. It's done under local anesthesia. Here, what we are doing is we are trying to recreate the hymen. And the procedure takes barely 20-25 minutes. But I always tell the patient that sometimes it is normal to not have a hymen, or hymen can get torn in some other activities like sports activity, horse riding. It's not and should not be considered as a sign of virginity. But yes, if the patient still wants to go ahead with the surgery, it can be done in an OPD basis. Now, there are certain do's and don'ts, of course, after the procedure. Although the procedure is very simple, there is not antibiotic, so pain is not usually a concern. Patient can resume their normal activities from the very same day, but you have to understand that you have to keep the stitches clean. The stitches will be there, but it will take time, around 3 weeks to get absorbed. So they have to keep that area very clean. They don't have to poke it or check it or put menstrual cups or tampons. They have to use a sanitary napkin, because if they'll insert something, the whole purpose of the surgery is spoiled. So those are the only precautions. Other than that, there is nothing major that a patient has to take care of.